Welcome to Spark and Heal podcast. When we talk about breast cancer, we often think about the medical part of it, about the physical part. But the mental impact is tremendous. Yet we don't often talk about this. Today, we're exploring the landscape of stress and anxiety with Frederick, stress and anxiety expert, who will hopefully share some actionable strategies to help us navigate tough times that stress is giving us. Hi, Frederick.
Hi, nice to see you again.
Nice to see you. Can we start with clarifying definitions? Who exactly is stress and anxiety expert? What do you do and how did you become one?
For anyone listening, I've been in high performance roles for most of my career, and grew up in a family with three brothers and two entrepreneurial parents. One of which was an Olympian at one point, and so there's been a very competitive spirit in the family. And at the same time, I had addiction and alcoholism in the family, and so I was constantly surrounded by this balance, or rather imbalance, of well-being and high performance. And throughout my career, I encountered similar dynamics with high achievers doing very well, but not feeling very good. And so uh, many years ago, I had a thought that struck me about why we have it so good but feel so bad. Because a lot of times, uh, people feeling bad don't necessarily have it worse than people around them who feel really good. And so I was curious about this phenomenon because most measurable aspects for most people in most places in the world has gotten significantly better. Life expectancy, child mortality, quality of life, access to healthcare, etc., etc. And then I came across, was very lucky to come across who is one of Sweden's foremost mental trainers, who my friend said, you need to meet this person. I met him. We had a fantastic conversation. We met again. And uh, that was the start of a very close relationship. He's now my mentor. And uh, what became very obvious when I started working with him was that um, the reality is not the reality, but only our perception of reality. And so a lot of times, in fact, the majority of stress that we feel, it is not about something that is actually happening, but rather something that has happened a long time ago and since passed, or something that will likely never happen. And so this made me very hopeful because now I know that there are tools like reframing and havening, that we will talk about today, that can actually help switch our minds and brains in a way that allows us to go through stressful situations without staying with the stress or staying with the struggling. And so now it's not a matter of, are there tools to help us feel good, because I know I've encountered them, I've experienced them. It's a matter of providing access to those tools. So that's how I got started, and since a few years back, I've been coaching primarily one-on-one with a lot of high-performing people in sales, in entrepreneurs and founders, and so forth, and also a lot of people struggling with chronic stress or anxiety. Not too dissimilar to a lot of the women that you have been describing.
And so, what is the difference between any talk therapy and working with you, for instance, particularly on stress and anxiety? Because in talk therapies, we can also discuss these topics.
Yeah, so I think there's not one door to happy. Um, the answer is what works is usually it depends. And I guess the way that we separate them, talking therapy or cognitive behavioral therapy, traditional therapy, uh, tends to be based on the premise that we open Pandora's box, and then there's a process of sort of processing the emotions through talking about it and sharing about it. And there's amazingly talented CBT therapists. However, um, I meet a lot of people who have gone to traditional therapy for a very long time without really finding resolve. And uh, many people go to therapy for years. And so what we work with instead are based on somatic therapies. And the what we're trying to do is not change the reality, which we never can, or make you talk about it to such an extent that somehow resolve will occur. What we're trying to do is help you uh, reframe feelings, thoughts, and beliefs that are standing in the way of feeling the way you want, or being who you want, or living the life that you want to live, and reframing them in a way that makes them manageable and positive. And so it's not about changing your situation, it's about changing how you perceive your situation. And so we, in fact, a lot of the people that I work with share very little details about what the sort of cause of their stress or their anxiety, because it's not necessary. We work with the reaction in the amygdala, where fear, for example, sits.
Oh, can you please continue developing this topic and explain a little bit more about how our minds react to stress and different stress factors?
Yeah. So, with the risk of getting a bit technical here, bear with me. But I think it's worth noting, and it's worth separating, that stress is not just uh, all things bad. So stress is really a body shift from balance to a state of emergency or fight or flight. And typically, what happens is our brain signals down to the spinal cord, and releasing adrenaline and norepinephrine, and this increases heart rate, and diverts blood throughout your body. And then what happens is it releases cortisol, mainly, and I think it's worth distinguishing between good stress and bad stress. And so if you think of an antelope on the savannah, they go through something that Robert Sapolsky, one of my favorite scientists and science writers, called acute stress. So the antelope being chased by a lion, that's acute stress. So this turns into a life-saving system. So it's very useful, and was very useful for humans when we were running from saber-toothed tigers. Now we no longer need to run from saber-toothed tigers, but the premise is still there. And then we have what Robert Sapolsky called chronic stress. And the difference, I suppose, is good stress is transient, meaning short term or short lived, and it's sort of on the balance between not boring but also not life threatening. And it can enhance memory and inspire, motivate. And then you have bad stress, which is again chronic stress, um, where if you think of a transient good stress, which is, okay, in 2 days I have a very important presentation, we get very sharp, we get very focused, that's short-lived, stress that lasts for maybe a few hours over the course of 2 days. Whereas chronic stress is a mortgage. Someone could stress over a mortgage for 30 years. And this is extremely stressful for the body. So that's an important difference to make. Um, so that's a little bit about what stress is and how it happens, and the different varieties of stress.
So when we have when our bodies are oversaturated with cortisol, what typically happens? It's obviously not a good thing.
No, it's definitely not a good thing. In fact, one of the things that happens is that our IQ lowers. So when we are in a fight or flight situation, or in a stressful situation, uh, our sort of uh, the way that I like to refer to it is mental real estate, of which we only have 100%. But when we are in a fight or flight mode, a big portion of that real estate is allocated to survival, and so we have less access to cognitive function and these sort of things. And so really we become a bit more stupid when it comes to making logical choices. And if you're in a really traumatic situation, then our IQ can get down to as low as half of our regular IQ, which is why uh, in um, um, in very traumatic situations like a severe accident with multiple people in or in a crisis situation, you can see people making very, very irrational decisions. Yeah.
Yeah, this is true. I can relate to that. When I was going through this stage of being diagnosed to my first treatments, I would, yeah, do something very irrational, even stupid, or even say something that I didn't mean to, because of course my mind was racing and going to like diverting from what I had to be focusing on. For example, like a conversation with a friend, I would just say stupid things or engage into some unnecessary disputes because, again, was not catering for this situation. Uh, I really want to focus on something that you just said, that a lot of stress is about something that is not here anymore or will probably never happen.
Yeah.
Uh, what is very typical for women who are already we can call them survivors, survivors after breast cancer. They live with a chronic PTSD
Mm,
because from the moment of recovery until the end of their life, approximately 80% of women have PTSD because they are constantly afraid that cancer may return. It may be a regular event, like every week, every month, but it's constantly present. And sometimes we have a pain somewhere in the body and we immediately feel this is cancer, or it may be triggered by a smell or by a certain memory or by a certain visual, for example, seeing a doctor or a needle,
mm.
something like this. So in comparison with other types of stress, this is still quite real because there is a percentage of women who may get the secondary breast cancer. So is it a different, like, first I would like to understand, is there a difference between these types of stress? And the second follow-up question, how to deal with this when a situation like blinding stress and anxiety happens?
Mm. I think uh, the first question I'd like to ask is, how do you know it's real? Why is that stress more real than somebody stressing over never having been sick and still worries about getting sick?
This is an assumption, and this
Yeah.
assumption is based on statistics that a certain percentage of women have secondary breast cancer.
Mm. Okay. So I think to sort of preface this, it's important to highlight that I'm not a medical professional, and I think when people ask me, unfortunately, the first and probably boring but most helpful answer is if you're in a situation where you suffer from what you're describing is what we're talked about before, which is chronic stress. So we're constantly stressing over something that hasn't and likely never will happen. And so I think the first suggestion is to get help. And this is, for some reason, this is not the obvious choice for a lot of people. And so if you were put in a car and you've never driven a car before, and somebody says, "Okay, what do you do now?" The first thing you would do is ask someone who knows how to drive a car. Yet when it comes to mental health and sort of stressful challenges or mental well-being, we we go about it, most of us, blindly because we've never been taught the tools. So my first recommendation is to reach out to someone who understands how stress works. And it is true that there's some sort of worry statistic from a university in the US. I can't remember which. And it's something around 91% of worries that actually never happens. And so imagine if you ask someone, uh, uh, I can help you alleviate 91% of the stress that you will ever have. And what a superpower that would be. Now, obviously this is taught over time, and when you work with a professional, there are tools that you can use to kind of bring back your nervous system. But what you're really asking is if we are in that state and we have a dysregulated nervous system, it seems to me that what you're asking is how do I regulate that nervous system when we're in it?
Right.
Yeah. So uh, this is obviously easier said than done, especially when our IQ is lower and we're in fight or flight mode and survival mode. And so obviously this is not something that will work perfectly the first time, neither is it meant to. But there are some ways to really reset. Um, and one of them is a sort of mental sigh, where we breathe in really heavy and then we breathe in super quick. And then we breathe out very slowly, twice as slow as we breathe in. And this works really well to reset the nervous system. And there's also lots of other tools like we practice havening, which you and I have talked about, which is you can do self-havening where we sort of pet our own shoulders or in our face. And we can also do it on somebody else who is having a panic attack, for example. And it's really to signal to the body that we are in balance. Things are okay, things are safe. So there's definitely lots of tools. I think the problem is not that we don't have the tools to make it happen. The problem is that most people aren't aware that these tools exist or how to practice them. And so, what do you do when you don't know how to do something? You go out and you practice. And so that's the first thing I'd encourage people.
Right. Can you think about other couple of techniques that could help manage this anxiety level and bring more balance to our nervous system?
Yeah, so one thing about worries, for example, is if you're worrying about something, again, 91% of the time that will never happen. Uh, One thing I ask clients that come into our sessions and they say things like, "Oh, I'm always procrastinating and I'm always catching up," or uh, "I feel like I never get anything done." I ask, "How do you know that this is true? What evidence do you have that this is true?" And because it's never happened, and because there's nothing around them that actually indicates that it will happen, except for their own feelings about their feeling, the answer is usually nothing. And that resets your own mind. So the problem usually is not the problem, because 91% of the time there isn't one. The problem is our feelings or perception of that problem. So it's good to ground it in reality and sort of separate our perception of reality with the reality. And I know we've talked about this briefly before, but perhaps it's worth mentioning for people that our brain cannot really separate imagined experience from experience, right? So it, if you believe that what you see when you're having a walk in the forest is a bear, your physiology will react as if you see a bear, even if it's just a tree stump. And so um, the difference between us and the antelope on the savannah, using the metaphor that I described before, is once the lion stops chasing, what does the antelope do? What do you think it does? The lion starts chasing, adrenaline starts, antelope runs, the lion gives up. What happens?
Antelope stops running.
Antelope stops running. And then it just goes back to grazing because the threat is gone. But what we do is we bring that chase, and then 1 month or 3 months or 6 months or 2 years or 10 years later, we think about the chase and we worry about the chase and we worry the chase might happen again, even though we're in Dublin and probably the lion will never come. And there's no evidence that the lion will start chasing us again. And we're the only animal, as far as I know, that brings a situation that was threatening with us even after the threat has passed. We're also incredibly creative with making up threats that will never happen. I have, I will start worrying about things that they're not real. Oh, what if I lose my dog? Well, my dog's 2 years old. Likely, he will not pass anytime soon. And we start to stress about it. So I think separating reality from our perception or perceived reality is really important. So what evidence do we have that this is true? Yeah.
Right. This is true what you said about evidence, and I try to remind this to myself when I have this PTSD waves. If I feel pain, I don't know, in my little pinky, and then I say, okay, this is not rational because cancer doesn't feel like this. And typically, cancer doesn't feel like pain, like from what I know. So I try to find different rational um, facts to calm my mind down. For instance, to say, okay, I just had my scan 2 months ago, so everything was clear. So next morning when I wake up, because usually these things happen during the night, I can schedule a check with a doctor or something like this. However, there is such a fear, which is called in cancer community, which is called scanxiety. It's fear of incoming scan. And typically every year, as a survivor, you have your mammogram or you have MRI, depending, like you clearly have mammogram every year, but like MRI or CT scan, depending on how your doctor decides. But these anxieties are real, and it's very difficult to stop your mind from racing because, in 2 days I have the scan, and what if, right? It goes into the realm of this imaginary, but at the same time, it is based on the past experience where we had the scan and we had cancer.
Mm.
So I would guess that yes, it's tricky, but try to be grounded as much and as often as we can, and always consult doctor, always ask for help.
Yeah, I think before you go, a few days before, when you know it's coming, because I suspect this happens frequently for people, is speak to whoever it is that you're speaking to, and there's plenty of tools to sort of help prepare and regulate our nervous system prior to going in, which is likely far easier than doing it once the system has already flooded. So you're likely over time far better off building up resilience, doing these kind of practices, uh, than you are trying to do it while being in the fight or flight mode. So there's no need to go into it already maxed out on worry and antsiness. Yeah.
So far, we talked about survivors, but what about people who live with metastatic cancer and who know that they have cancer, and in some cases, this cancer might taking more and more space in our bodies, and that we are approaching death? How to deal with this type of stress?
So the question is this question about people who have cancer that they know will evolve and is likely fatal, or
It's a question about people, yes, who have metastatic cancer and they know it's evolving.
yeah, really good question. I think in times when you're going through traumatic experiences, you should really have a trauma expert or trauma therapist, and work with them closely, because obviously um, we were never meant to handle these situations alone. Yet for some reason, today, when we have more resources and more science and more access to help than we've ever had, we insist on doing it alone. So I think the short, easy, and the only um, correct answer I could give is to get help from a professional.
That's for sure. You mentioned that we have so many tools today, so many resources. We have internet, we have artificial intelligence, what have you. By the way, would you suggest using AI to manage stress and anxiety?
I would not rely on AI for medical advice in the same way that I wouldn't for any other medical advice. I think um, AI can be incredibly helpful in understanding things like what tools are available, where can I turn, what are the professionals I can lean on, where can I find them, and it's really good at researching those type of resources. But it's again not a medical professional. So um, i- if if you are having heart problems, would you rather speak uh, to an AI or a cardiologist who specializes in heart problems?
Do you think that AI can at least help managing anxiety when it happens, for example, during the night and a person doesn't have or cannot just simply call to their doctor because it's middle of the night?
Yeah, I think AI can definitely help you research tools and methods that can help regulate the nervous system. I mean, a lot of the tools are out there. They're on the internet. They're available for people to find. And so I think you can definitely find useful tools with AI, but I wouldn't rely on them for example, diagnosis or uh, things of that nature. Yeah.
Yeah, of course. So bringing you back to the survivorship and the situation with finishing active treatment, returning back to work, returning back to your social circles. Very often we are self-conscious about the change that has happened. We may go back to work and our hair is still short. We had mastectomy, we have all the scars. So this may create a situation where we feel too exposed and we may feel stress going into these social and professional circles because some people may react very openly and ask questions. Some people we withdraw. What would you recommend in this situation?
What's the worst thing that could happen? You're going into a new workplace. Uh, you've just gotten cleared by your doctor. What's the worst thing that can happen coming into a new workplace?
I imagine that people, women or men also have breast cancer, but mainly women would feel bad. They would feel that somebody may gossip about them, say about their inability to perform in the same level and stuff like that.
And what if they did?
It's all in our mind, right? Or
Typically,
most,
nothing happens.
yeah,
If a 2-year-old came up to you and said, "You're not qualified to do this job," would you believe them?
probably not.
Probably not. So why would you believe somebody else if they told you that? Do they know or do you know? What evidence do you have that that's true? That somebody else said it? Okay, it's their opinion. It's important to understand that people have opinions about other people, whether you went through cancer or not. And the only difference is you've actually gone through something like cancer. And so what is that in relationship to what you've gone through? If you can handle that, you can handle a 2-year-old saying that you're not qualified or a colleague who knows nothing about you who says you're not qualified. So what's the worst that could happen? Someone has an opinion. Okay. One more opinion in the opinion bank.
What are you saying is managing this expectation, not expectation, managing this belief or this image that we create in our head versus actual facts.
Yeah, but what you're describing is not the problem. The problem is not that people may have opinions about your qualifications or opinions about your ability to do the work, or what you're describing is your opinions about those opinions, your worry about those opinions, your thoughts and beliefs about their opinions. So perhaps it's easier to change those than people's opinions. Yeah, that's what I would recommend. Someone taught me many years ago, and this is not a scientific thing, but I encourage people to try it. When you get frustrated with someone or annoyed with a different person or um, a person that you feel not very fond of, think of them as a child or a really old person. Think of them, who were they when they were 2 years old or 3 years old? And then see if you still feel as angry or annoyed with them.
That's a very good advice.
It works very well. I go from very angry to very compassionate.
I hope that everybody could think about this in most situations.
Everybody can think about this. This is not a magic trick. It's just a practice.
What I liked about our conversation is that you provided a lot of very practical and down to earth tools and advice that can be used continuously on daily basis, especially when assessing these traumatic situations and encounters, confrontations, or uh, perceptions that we have. And to finish, what do you think can help everyone? One little thing that we start doing every day to become more resilient to stress.
Yeah. Um, I think first things first, you should, people talk about a lot of micro things when it comes to well-being. I'm a firm believer in getting the basics right. So again, with the risk of sounding very boring, sleep is extremely good. Eating good food is really good. Activity is fantastic. There's plenty of research that shows that I think it's way above 30% of depressions could be prevented if we simply activate our bodies. And so these are real working um, tools that we have at our disposal, all of us. And so I think getting those things right. And I think for me, the greatest superpower I've ever learned is the ability to reframe things. If you think of something simple like uh, it's Saturday morning and I have to drag myself to the gym. I have to go to the gym. And it feels like climbing a mountain. And what would happen if you instead say, ah, how grateful I am that I am able to go to the gym, that I'm capable to go to the gym. I get to go to the gym and see what changes. I think that's the greatest superpower I've ever learned. There's a beautiful book, um, Man's Search for Meaning, which is written by Viktor Frankl. I'm sure many people have heard of it, and it's about a person who I believe was a psychotherapist or a therapist of some sort, and he survived I believe, two concentration camps during the Holocaust, and there's plenty of amazing pieces in the book, but something that I remember very clearly was this is a person who is in a severely um, traumatizing experience, and a lot of people died simply for a loss of hope. And they're on the train, I believe, to the camp, and they're going through the Alps somewhere, and everyone's looking out the tiny holes in the train. And in the book, it's written something in the likes of, and I really apologize for butchering it because I can't do it proper justice, but it's written something in the lines of, um, if you saw the people in that train looking at those mountains, you would have never thought that they were going where they were going because everyone was enamored by the mountains and the beauty of the mountains, and that's what they were focusing on. In a moment like that, of absolute crisis, it doesn't change the situation, but I guarantee you it changed everybody's feelings in that moment about that situation. So I think reframing is unbelievably liberating.
This is a beautiful example that even in the most horrible, like life-threatening situation where every day you could be executed, you find hope, you find the foundation to be human, to continue seeing beauty, to remove this stress somehow and focus on essential that you have right now. So thank you again for these practical tools. I for sure have written down a few things that I will try to implement into my daily lives when it comes to stress. So hope that those who listen and watch us can also find something, at least one thing, very helpful and use it.
I
And
hope so too.
if somebody wants to learn more about what you do, how they can find you.
The easiest way to find me is to go on my website. It's my first name, last name.com. Fredrik, Fredrik, Hagbom, Haggbom.com. They can book a free consultation or a one-on-one session or a workshop talk. That's the absolute best way to reach me. I am on LinkedIn, but I'm very rarely there. I'm in the tech world too much already, so I try to mitigate my time there. But my website, I can be found any time of the week.
I will make sure to put your link in the box, in the description box below the video. Thank you,
Okay.
Frederick, for your time.
Thank you for having me. Have a nice weekend.
You too. All the best. Bye
All
bye.
the best. Bye bye.